Yeah, sorry. I'm Heather Davis. I'm your territory consultant for the entire Palm Desert area, Orange County, and San Diego for Glytone products and for Aven. We're owned by a pharmaceutical company actually called Pierre Fabre, which is based in France. And Glytone, actually, we purchased Glytone a couple years, like 10 years ago. It's been around since 1943, so it's a brand that's been tried and true. Been around for a long time. The products itself have been obviously upgraded and enhanced, and even though Mercedes has been around for a long time, you see new versions of Mercedes all the time with new bells and whistles, so that's how Glytone is too. We always update all of our products. So it's based on the free acid value. Does anybody know what that is?
Yeah, so that's not bound down by any other chemicals.
Exactly. So it's 100% bioavailable. The glycolic acid is 100% bioavailable to the skin. So as Glytone, as you know, is based mostly on glycolic acid, which is kind of the gold standard in skincare. And the difference between our glycolic acid and some of the other companies is that ours is free acid value, which means when it says 20%, you're getting 20% directly to the skin. It's 100% available to the skin. It's not buffered or encapsulated. So a lot of other products, it'll say 20%, but your skin is actually only getting 12%. So that's why sometimes our products sting a bit, because it is 100% free glycolic acid. So it delivers glycolic acid skin to the lower controlled pH formulation. Some of our products are time released, so it just depends on the product, but you can rest assured that everything in the Glytone line is free acid value. So why use glycolic acid? You know, it's been around a long time, but the reasons are really, like I said, simple, been tried and true. It can help reduce fine lines and wrinkles because it's a keratolytic. It helps slough off the dead skin cells on the top of the skin. If you're using it daily, you're kind of giving yourself like a mini micro peel every day. It can help uneven skin appearance, tone, and texture. And then it can help with photo damaged skin. So people that have the brown spots, just that uneven kind of look, they want to clear up, even on their body. Glycolic acid is a great ingredient for that. And then it also helps prepare the skin for other topicals. So you can use a glycolic acid wash and then, recommend, the TNS or whatever else, your sunscreen, and it helps actually, prepare the skin like a nice little base foundation for what you're putting on, because it completely clears the skin of any dead skin, and it preps the skin for the receiving of the other ingredients that you're giving them. And then it's scientifically proven. There were 74 women ages 40 to 70 years old, and they were using 8% glycolic cream, and they found a 78% reduction in photo damage, and that was after 12 weeks. So it's, like I said, it's been tried and true for a long time. Glycolic acid's been around for a long time, right? So let's just get into the products. So the mild gel wash, has anybody tried it or seen it? Okay, this is our #1 selling product in the entire land of Glytone, and we have over 100 products. So, it definitely speaks for itself. It's around, I think you can sell it for $30 here. So it's a pretty, decent priced cleanser, and it has a 4.7% free glycolic acid with a glycolic, and it removes dead skin surface cells. It's really easy to use. It doesn't really sting or burn. Everybody, anybody can use this product, even if you're kind of sensitive, even if you're kind of dry. It's not going to overly dry you out because it has ingredients in there to help not moisturize, but just not dry out the skin. And then it has some conditioners in there too. It's fragrance free, and it lathers up and removes your makeup and dirt. So this is a great cleanser to use if a patient has acne, if a patient just has a little photo damage, or you're going to be giving them some other products that you sell. You want to prep the skin. It's a great product to give. I mean, almost everybody, unless they're super, super dry and they need like a really, milky cleanser or a moisturizing cleanser, or they've just come out of a laser or surgery or something, most patients can get this product, and really, they'll really love it. We never get returns on this product ever, so. Any questions on it?
Can they use it daily?
Mm-hmm. You can use it twice daily, or as 3 times daily if you want to, but we recommend to use it twice a day, morning and night. Any other questions? Mild gel wash? It's pretty straightforward. It's 4.7% free glycolic acid wash. It's pretty amazing. It's our #1 seller. So now I'll go through the body line. So you have 2 products, but they're both one's in the other one, so it's kind of easy to go over. But you have the KP Kit, and then you have the body lotion, which is also inside the KP Kit, but you sell it separately, just so you know. So the body line utilizes the free glycolic acid again to help reduce the KP, which are like those red bumps on the back of the arms, or some people get it on their legs from exercising or the friction, and just the rough, bumpy skin. And then it also helps with dry, rough skin. So people just kind of want to smooth out their skin, like they have scaly plaques like this, or they have cracked heels, elbows, and knees. This delivers a high dose of glycolic acid to those, to those areas. And what's nice is like a mini, I always call it like a mini peel for your body. So, people protect their face and they do all these things with their face, but they don't really focus a lot of times on their body. And this is a great line to do that, and it's super easy. So what the KP Kit includes is a cleanser, which is 8.8% free glycolic acid, and then the lotion, which is 17.5% free glycolic acid, and then a loofah. So that's everything they need to help with their body. So they just basically, they can use it twice a day if they want to. I would have them start once a day because it is pretty strong, and just loofah in the shower with the cleanser, and then follow up when they're still a little bit damp with the lotion, because the lotion is a little thick. I mean, it's 17.5% glycolic, so it's a little bit thick, so it's nice if you when you get out of the shower to put it on. Tell them too, if they're very sensitive to glycolic, that it might sting a little, the lotion. So if it does, then mix it in with like a CeraVe or something, or another line until they get used to it. But they will see a huge difference already, just using this for a couple weeks. Any questions on the KP Kit? Yeah. We don't have an age limit on it. I mean, I would just, it depends. Yeah, I think it would just depend on your recommendation. Yeah. Yeah, if he's just using it there. Yeah.
How they tolerate it, you could try it. I don't think there's really an age limit. It probably wouldn't be more than 5, but just try a little bit on a small area.
Yeah. Yeah, I mean, I have teenagers using it because a lot of teenagers get the KP. I don't know. We haven't studied it on pregnant women. I don't think it would be a problem, to be honest.
Glycolic is safe for pregnant women, doctor. Glycolic is safe for pregnant women.
I can get an answer from the company if you want on that, but yeah. I mean, I would say the cleanser would be fine because you're just gonna wash it off. Yes.
How long does it get wax?
If you're using it every day, I mean, the thing is, the cleanser is gonna go a lot faster than the lotion, obviously, because the lotion is really thick and you don't need a lot. So it just depends. Like if they're using it every day, it'll probably be about a month for the cleanser and 2 months for the lotion. But it just depends, like I said, on how often they use it. But you can tell them it'll probably last about 2 months or so if they're using it daily. Anybody? Oh. And the mild gel wash, I would say about 2 months as well. And you don't need a lot of this stuff. I mean, it spreads pretty evenly. And then this is also a great thing for people, not just with the bumps, not just with the plaque, scaly skin. It's just great for people that want to have, glowing skin on their body, and they want to have like a mini peel, and they want to even out the photo damage on their chest, on their arms. It's a great way to help them do that too, especially if you're doing any like lasers or anything like that to follow up with. This is a good way to maintain. And just let them know too, I mean, because they're going to be exfoliating so much, they do need to wear, if they're going to be outside, they need to wear sunscreen as well, just because they're peeling their body every day. Real quick to the Anacaps. Does anybody, this is kind of newer product for here and for the company. Does anybody know about this or hear about it? Okay. So I'll open it up. You can see. So inside this box of Anacaps, it's a dietary supplement for hair growth. We have a whole line of hair products now that we took from Europe, that have been in Europe for 12 years. And we've got one for men and one for women, one for scaly scalp. I mean, we just added so many of them. But part of the treatment for the hair loss, chronic hair loss, and occasional are these Glytone Anacaps. There's a month supply in here, and patients take 2 a day. So people always ask, like, what's the difference between these and like a $5 biotin at Target? That's what they look like. These have been studied. We have clinical studies on these to prove that they are that much better for hair restoration, hair growth, and they include a lot of different ingredients as well that biotin doesn't. So they include the soya isoflavonoids, which support hair growth into the hair follicle, and they preserve from an early aging, so it kind of has antioxidant action. Now this is a soya isoflavonoid, so if you have somebody that has like hormone response cancer or something, they have to stay away from soy products. So I mean, you would know, right, if they did, so I wouldn't recommend them just because, like, for example, my mom had breast cancer and it was hormone responsive. She would not take these just because soy is, you know, people know that it kind of produces estrogen, and yeah. But that's probably not the majority of your patients, but just a disclaimer. And it has vitamin E, methane, and cysteine, which is amino acid that boosts hair and nail. And that's what we did the study on. And that's what really proved to be the kind of the gold star ingredient in this product. And then vitamin D complex, which supports the cellular metabolism in the hair and helps reinforce its structure. So this is, you know, a lot of people with hair loss or you know, people that don't have a good diet, they need a supplement to help them kind of boost that, and they need to have that kind of exchange in the bloodstream into the hair follicle, and this can help a lot. And like I said, we've studied it extensively, and it did prove efficacy. So these are, like I said, 1 month supply in a box. Take 2 a day, anytime. Food, no food, doesn't matter. Any questions? Yes.
What percentage of increase with the person using that product you have per month?
They didn't give us that information, but I could have them send it to the doctor, and then we could share that. It's kind of like proprietary, I don't know. Can't really tell us. It comes from Europe, so.
So what is that?
Yes. They bought it from Europe, basically, and yeah. But I do have a doctor in Anaheim, Dr. Efron. I don't know if you know her. She is like the hair queen over there. She's my big, you know, one of the top sellers of the hair line, and she loves it. And she's tried, you know, she's done it where she's given patients the treatment, which is the shampoo and the serum, and then not given them the Anacaps, and then given patients the whole thing, and she said the Anacaps made a huge difference. So I have seen it live in the office. Yeah.
You know, a lot of the vitamins they are not really absorbed by the body; they just sort of pass through. Is there kind of any of the studies address absorption, or they're actually getting into your bloodstream?
No, not yet. I mean, we haven't really done. We just brought these in June, so more to come. I think we're working on a study right now. But like I said, just from the doctor that I have, that she sells tons of this. She has tried not using the Anacaps, and I'm just saying go to Target and get a biotin, and she's seen better results with the Anacaps. And she thinks they're too expensive anyways, but she still buys them because she's like, that this is important.
I've been taking it for a couple weeks now, just based on the capsules. I think that they are time release, so as far as absorption, I feel like it's probably kind of cycling through your system throughout the day because they aren't just encapsulated.
I'll try it.
So far, it's good.
How much are
And
those?
I will get updated information once the studies are done. These are 1950, so about 40.
They're big for Make sure you get retail prices when you're talking.
Okay. Yeah, it's sometimes.
Because he's recording.
Oh, okay.
But just real quick, does it come in a different supply? Because that's only a 30-day supply.
No.
Because you need 3. So we
Yeah.
should really be selling them in 3s. I just want to point that out because we'll come into the same thing that we came with Latisse and they won't see any results. Because if they're not going to see any results for 3 months, we should just all try to strive to sell them in 3s.
Great point. Yeah, like I said, like it's 1 month. They may come out with something in the future that we're just sort of getting feedback right now. It takes about 3 months.
I just read an article this morning about how, you know, if you are using these supplements, it does increase your hair growth. I mean, so there's a study on science.
And it is the new trend right now.
It's similar to me more so than comparing it to biotin. For me, it seems more similar to like Hair Affinity. And those are a lot more expensive and everybody buys those.
Those are,
people
I mean, people people, those must be working because they're all over the place.
Everybody buys.
Yeah. The
And that's
whole,
what it seems similar to, so the price is right.
yeah. I mean, some, like I said, I have a doctor that thinks it's too expensive, but you're getting a lot more out of it than just biotin. So any other questions on the Glytone product?
Another question just regarding what is the shampoo and serum that we don't carry?
So we just launched one for men, but the one that we had prior that's been kind of out there right now is called Chronosteam and Neoptide. There's a shampoo and that's called Anaphase, and that basically opens up the hair follicle and re-energizes the hair when you're shampooing. It's more like scalp treatment in the shower. And that's $25, so it's not expensive. And then it delivers, yes. And then it delivers biotin and other vitamin directly into the scalp. And it also preps the scalp for, receiving the serum. And then the serum is just a 3-month supply of spray that you spray into your hair once a day, and then just massage it in. You can do it anytime, wet or dry. Pretty amazing. I mean, and what it does is it actually, like I said, it re-energizes the hair. It promotes the exchange of nutrition in the hair bulb, and also it attacks the substance P, which is very common in female hair loss. So we have one for women, and then when we just launched, you would use the same shampoo, but it's a day and night formula for men, and it has a saval and lauric acid extract, and that helps block the DHT.
I got a question. Because you were just asking if you have any more questions about the Glytone product.
Yeah.
We just decided that we're going to carry the Avene SOS kit because we're not going to be having the Skin Medica Postal Blade kit, so we're going to use it.
Yeah, that's on that.
Can you talk about that?
Yeah, that's going to be on here. Because you just ordered it yesterday, so I added it to the presentation. Yeah, I just didn't have one to bring, but I have some of the stuff from inside to bring. So this kit is seriously amazing for a lot of the stuff you guys do here. It's a picture of it. So this is what it looks like. It has a lot of things inside, but everything is crucial for repairing the kit after surgery, lasers, peels, even for just people that have have horribly sensitive skin. They can't tolerate anything at all. This kit, you can send them home with this. So it includes a facial compress and then thermal spring water, which looks like this. So it includes these kind of funny looking masks. But this is great. So if you've just gotten a laser or a peel and your skin is very irritated and just burning, you take one of these and then you take the thermal spring water, which is included. And this water is 100% sterile, neutral pH, rich in silicates and minerals, and it cools the skin on contact by 50%. So people are burning, they come out hot, or they just want some relief from the burn. They would just spray this, and kind of saturate it. Some people do it inside the pouch and then just lay it on their face, press it down, and it delivers the water into the skin safely. This is really soft too. I'm gonna pass it around.
How many come in a kit?
I think 30 come in this SOS Complete, and you can get extra ones too if it's not enough. Oh yeah, of course. So these are what they come in, like little pouches like this. Some people just take the top off and spray the water and get it damp in there and then take it out. It just depends, but you can tell them how to do it. These are great. So it comes with those two things, and they can use those whenever they want to. They can use those whenever they want. I mean, it's not going to harm them. There's no real active in there. It's just soothing, calming water. And like I said, it's 100% sterile, so if it's a bladed skin, it can go right on top. Post-surgery, can go, people sometimes have plastic surgeons that have them clean out sutures with that water because it is sterile and it's not going to hurt you. And then it comes with Cyclopate, which is a really well-known healing agent. So it actually works better in the clinical studies 2 times faster than Aquaphor, Neosporin. I'm almost done. Aquaphor and Neosporin, it works 2 times faster, so it has sucralfate in there. And then zinc and copper sulfate, which is, it helps stop the proliferation of bacteria and fungus. So it can help also heal, but also stop that process. And obviously when your skin is open, you have, a lot more opportunity for bacteria and fungus growth. So that's in there, and they can use that right after they get home. I mean, right when they get the kit, they can open that up, and they can use that on top of the ablated skin. And you'll see it's like a white film, kind of, because it's got zinc oxide in there. but it's very cooling and very soothing, and they can use that twice a day. And this is all in the instructions inside the kit too. And then it has, for maybe a couple, 2 days, 3 days later, depending on what they just did, there's a cleanser, which is Tolerance Extreme, and a cream. So that's what they use to wash their face with and moisturize with. The cleanser has 6 ingredients only, and the cream has 10. So it's very minimal ingredients, no preservatives, no parabens, it's all sterile. So nothing that can further irritate the open, ablated skin. And that's their whole kit that they need to get them through their post-procedure. So that's everything that they could possibly need. Yes.
Is the, So the water, is that small bottle going to be enough to get them through, or
Yeah.
does it come with a bigger bottle?
Yeah, the small bottle will do it. I mean, it lasts a long time. These things last a long time.
Is there any sunscreen in that?
No sunscreen. It's a really good question. This has, I mean, like I said, all these products in here are made, they're all sterile, and they're all made for the utmost sensitive skin, minimal ingredients, people that can't tolerate anything. Because your skin, obviously, you don't want to be putting on heavy chemicals or parabens or preservatives on open skin. And then the Cyclofate in there really helps to heal ablated open skin. You can put that on. It's like, I call it like a 911 cream.
What's the Scotch or how thick is the cream that comes with it? It seems like if
not
they
that
have that laser done, that they're going to be constantly putting that on to keep their skin from drying out.
Oh, the Cyclofate is what they put on immediately afterwards. That's thick. That's really thick. I'll leave you guys with one, so you can even use it in the office if you want, because it's great right after. It's really thick, because we had to actually reformulate another one called post-procedure that's really thin, because people were complaining it's thick. But for ablative procedures, it's really nice. People love it.
I got a question about the kit, because I was reading the specs. So this kit, everything that's in there, they should start using right away, like a way to, like they don't have to wait to use anything.
No, it's meant, a lot of people include it in the price of the package of the whatever laser or whatever, because this is, you just say everything else you've been doing, stop doing. This is your new kit for the next week, 2 weeks, whatever you recommend.
That's all they need to do.
And then a sunscreen, obviously, hopefully non-chemical
Sunscreen
based.
after they get the new skin. How much does that retail for?
So it's $49 to use, so 98, about $100.
Yeah.
What was on here? So about $100. So I was just gonna say that it's, it's a full skincare
But
regimen.
you guys, just so you know, they're still going to get the recovery complex, so, because that was always on the side.
How long does the kit last?
I mean, you'll have this way long after they're probably already healed. I would say, so spray, the facial compresses, those little masks will go a lot faster, obviously. But the water will probably last them this whole thing will probably last at least a month and a half, 2 months.
Okay.
The Tolerance Extreme, the cleanser will last, the big cleanser. And then the cream, depending on how much they use, should last about a month. And the Cyclofate will last them, they'll have that in their medicine cabinet for a long time because it's really thick. But that, like I said, you could use that diaper rash, open cuts, scrapes, any rashes, anything you want to heal, anything open. And the other thing, I think that was it. Yeah, so just recommend it to